Dear friends, good morning. We'll talk about a very important disease today, that is Diabetes Mellitus, or so-called Madhumeha in Ayurveda. Friends, this is important to appreciate that as on today, more than 7 crores of Indians are suffering from diabetes, and it is estimated that by the year 2025, there will be as much people as WHO wants to declare India as the capital of diabetes. This is important to appreciate that this can occur at any stage, in any age group, at any time of the life. Commonly, there are certain factors which aggravate this disease, which include obesity, lot of consumption of alcohol, sedentary lifestyle, tobacco use, smoking, stress factors, and above all, the genetic factors in the family. They play a very important role in predisposition of this dreadful disease from one generation to the another one. There are certain symptoms by which we can assess that probably the individual has diabetes. There is onset of the diabetes in the body, and they include excessive thirst, excessive appetite, excessive urination, progressive body weight loss, progressive weakness in the body, tiredness in the body, and some unexplained superadded infections in the body, delayed healing of the wounds. These are some of the symptoms which specifically, categorically indicates toward the onset of the diabetes in the body. It is important to appreciate that there are certain laboratory investigations through which we can just monitor the progress or the level of the blood sugar level in our body, so that we can just see whether one is on safer side or is likely to develop diabetes. There are certain investigations of the blood in which we just try to analyze the level of blood sugar level. One important test is fasting blood sugar level. It is important to appreciate that not more than 110 milligram per dl should be the fasting blood sugar level. Then we have another test, that is hemoglobin A1C. This indicates the average of previous 3 months average of the blood sugar level in the body. 4 to 6% per dl is supposed to be normal range. Then we have postprandial blood sugar level. Prandial means food. After eating food or breakfast, after 2 hours, the blood sugar sample is taken and the level of sugar is assessed. It should not exceed 140 milligram per dl. Then we have another important test, and that is the after postprandial we have another important, that is random blood sugar level. And random blood sugar level means when in a diabetic person, the blood sugar level at various occasions is variable. But in a person who is not having any diabetes, most of the time, whenever his blood sugar level is tested, it is almost constant or near to each other. It should not exceed 200 mg per dl. Another important test is the urine, in which we have to just see the urinary glucose level. Once the diagnosis of diabetes is confirmed or Madhumeha is confirmed, lot of description is available in Ayurvedic classics for the successful treatment of this disorder. This is important to appreciate that this diabetes or Madhumeha is such a notorious disease that it spares no organ of the body. Although the blood sugar level may come within normal range, but the individual continues to have various complications in the body in the form of some ophthalmic disorders, in the form of cataract, retinopathy, neuropathy, diabetic nephropathy, that is the history of diabetes leads to the failure of the kidneys, coronary artery disease, high blood pressure. These are some of the disorders which arise as a complication of diabetes in the body. It is important to appreciate once the diagnosis has been established of diabetes, then we have to remove the causative factor, or what we call as Nidan Parivarjan. Whatever is the factor, that has to be removed. Then there has to be dietary modification of that individual, for which lot of seasonal fruit and vegetables should be included in the diet. Less sweet fruit in the form of apple, amrud, amla, they can be taken, but very rich carbohydrate concentration in the form of grapes, mango, papaya, chiku, these should be avoided. Vegetables having high fiber in the diet can be added to one's food, like carrot, turnip, methi. These are some of the things which can be included. Salad, fresh, high fiber salad should be added to the individual. For preparing the roti or the chapati of a diabetic person, we can take 4 things, namely wheat, gram, methi, soybean and jom, that is the barley. The combination of these may be a very, very useful chapati for the individual. Cake, pastries, hot drinks, wine, then sweetened things, sweets, high caloric diet, these are to be strictly avoided. Milk products like curd, buttermilk, they should also be cut down in the regular meals. Barley is supposed to be one of the best for the management of Madhumeha, so that its consumption in the body has to be increased. Then there are certain lifestyle modifications which are mandatory to be done by the individual. Sedentary lifestyle has to be converted into some light exercises regularly being conducted by the individual in the form of running, walking, swimming, playing various games. Idea is that the calories have to be burnt. Similarly, 6 to 8 hours of the sleep per day is very important for an individual. Consumption of those things which put on weight in our body, that has to be cut down. Physical activities have to be increased. Mental stress has to be cut down. Anxiety, depression, they have to be taken care of properly. Then there is a lot of description about the internal purification of the body in the management of a person suffering from diabetes or Madhumeha. Vaman, Virechan and Bastikam, they are indicated to be done in these individuals for internal purification, so that these have detoxification effect in the body. Similarly, we have a lot of description of Ayurvedic medicines, herbal, mineral, medical preparations are available which are very effective. Very, very selective medicines can be used by the judicious judgment of the doctor to individuals, and the requirement can be variable. Then we come to specific Naimittik Rasayan or the Achar Rasayan, which can be taken in the form of Amalki, Gugulu, Rason, Bhallatak. These can be taken in the form of Rasayan. Shilajatu, one very important Rasayan for patients of diabetes. Similarly, yogic exercises, they can be very, very important contributory factors. Awareness amongst the masses is very important, just to educate the people how they can get rid of this dreadful disease. In case you have diabetes and you are looking for some Ayurvedic center where you can get treated your diabetes or Madhumeha, effectively, you are welcome to contact Bhagwati Ayurveda and Panchakarma Research Center, which is located in Jaipur area in Jaipur. The address is available on the Google map as well as it is flashing on the screen. Qualified doctors are available there whom you can contact and they can contribute, they can help you in getting rid of this dreadful disease. Thank you very much.